Good afternoon, everyone. Thank you for joining us today. This series was made possible in part through the generosity of Amgen, and we thank them for their support. My name is Florencia Nachetto, and I'm the Senior Director of Health Initiatives and Education here at the American Kidney Fund. Before I turn over to today's speaker, I'd like to direct your attention to the control panel that you see on your screen. All participants are on mute, so we won't be able to hear you, but we welcome your questions. To our healthcare professionals, we're glad that you've joined us today and hope that you recommend this webinar to the patients that you work with. However, a friendly reminder is that this webinar is not accredited for continuing education credits, and you will not receive a certificate upon completion. If you believe that your attendance of this webinar may be honored by your credentialing body, we'll be happy to send you a certificate of attendance after the conclusion of today's session. Simply email us at education@kidneyfund.org. Without further ado, allow me to introduce today's speaker, Ms. Janine Leon. Janine Leon is a clinical dietitian, researcher, and program evaluator at the Metro Health Medical Center in Cleveland, Ohio, and also an adjunct instructor of medicine at the Case Western Reserve University School of Medicine. Janine has provided nutrition education and intervention in a variety of inpatient, outpatient, and dialysis settings. Her nutrition and research interests include food allergies and sensitivities, phosphorus in the food supply, adult and pediatric obesity, and health disparities. She frequently educates dietitians regionally and nationally on the topic of phosphorus additives. She has served on the American Kidney Foundation's Council on Renal Nutrition Executive Committee, the Board of Trustees for the Renal Network, as an editorial board member for the Journal of Renal Nutrition. In April 2016, Janine received the Joel D. Koppel Award from the American Kidney Foundation for her research and nutrition education on phosphorus additives in the food supply. Thank you, Janine, for joining us.
Thank you so much. Hello, good morning, good afternoon. I'm glad to be here today. During this webinar, we're going to talk about nutrition and really what can patients on dialysis eat. And during this, there's three key areas I want to focus on. The first is how much protein is required for dialysis. I mean, as a renal dietitian, I've spent so much time reviewing lab work, weight changes, and often the conversation swings back around to how can I get you to eat a little more protein? How can we add more protein? So I want to talk about how much is really required and how a person might be able to actually meet this requirement. I'm not seeing that I can advance my slides. There we go. Now, the second question is, what is the difference between phosphorus and potassium? I think as a patient, that's often very difficult to discern, and then even possibly more difficult if you're a patient's care provider and trying to figure out just what am I going to feed my loved one. So I want to talk today about, well, what can safely be eaten to manage these? Can you see? Thank you. And then thirdly, how to manage fluid balance through careful sodium, salt, and fluid use. This all starts with good nutrition. The goal of good nutrition is to avoid malnutrition and preserve or achieve healthy body weight. It's difficult sometimes for people to understand that gaining weight can be as difficult as losing weight, and that we all are quite comfortable knowing individuals that have trouble losing weight, so it's easy to understand that. Secondly, good nutrition promotes healthy body functions and reduces risks associated with uncontrolled diabetes, high blood pressure, heart disease, or some of the other comorbid conditions we often see that ride along with individuals who have kidney disease. Thirdly, good nutrition can prevent mineral and electrolyte abnormalities. So when you get your lab report from the dietitians each month or each quarter, you have that opportunity to modify your diet to try to make this better. Can we advance the slide, please? And then fourth, promote better immunity. What we eat has such a role in how well we're able to fight infections and just stay well, so not only overcome infections but avoid them in the first place. Okay, next slide. Good nutrition truly starts at the grocery store or when you're sitting down at a restaurant table and attempting to figure out, now what am I going to order? This picture comes from one of the research studies I worked on looking at phosphate additives, and as I was loading up the counter with the foods I was going to analyze, I turned around and was stunned by all of the beautiful colors displayed here: bright orange, bright blue, bright red. And when I brought this food home, my children said, "All right, when's the party?" So as you can tell, so many of the foods that are marketed to us today are really appealing, and manufacturers have developed food in a way that they find triggers what they call our bliss point. It's a recognition by our brain that this food tastes really, really good. Or another term is hyperpalatable, meaning it's better than really what you would find in nature. So that's what we're up fighting against. So when you're looking at all of this stuff, you have to really ask yourself, but is this what's really necessary and best for my body? And how does that fit with my nutritional plan and goals as I go through this dialysis process? Oops. Good nutrition at the end of the day really ends at the plate sitting in front of you. So when we have all of those choices to make at the supermarket or at the restaurant, it's really those decisions about what's before us that matter the most. And so we're going to talk about that at length. Let's start with some basic nutrition components. Macronutrients are the major nutrients that are available for our bodies to use: proteins, carbohydrates, and fat. Protein is found predominantly in animal foods like chicken, turkey, meat, fish, eggs, dairy products, but also in plant products like soy, which is full of protein, vegetables, and there's a little bit of protein in grains. In the carbohydrate area, starches, sugars, fiber, those will provide a lot of the calories and a lot of the nutrition that we need. And those can be found predominantly in vegetables, fruits, and grains. And finally, fat, whether it be animal-based or plant-based, is the other major category for macronutrients. And we have to be careful that we don't have too much, but it's important that we really incorporate enough of that, again, so we meet our caloric requirements. In terms of micronutrients, these are what you can consider the little nutrients that have big jobs. Micronutrients are essential to the body because they have so many different roles in the body. There's micronutrients would be comprised of vitamins, B vitamins, of which there are many, the C, D, E, and K vitamins in particular. Minerals such as potassium, phosphorus, calcium, sodium, and iron. And we often hear these terms in the dialysis patient area being referred to as electrolytes. But those are all items that we frequently find on our patients' lab reports, and these are areas that are really impacted by the kidney, and so we need to be very careful in the way we approach those and manage those when we're figuring out what we're going to eat each day. So how much protein is really required for dialysis, and how can we meet this protein requirement? Protein truly functions as building blocks. If you think about Lego box, whether that's your children, your grandchildren, kids playing, you really have to start with a firm foundation, a good base. And those proteins are essential, and they play a role both in your overall health and then also preservation of your muscle mass. Protein needs are actually higher than typical because of dialysis losses. So whether you're having hemodialysis in center, hemodialysis at home, or peritoneal dialysis, your protein needs are going to be higher than if you did not have advanced kidney disease and need dialysis. The amount required each day is primarily based on your body weight, and I'm going to provide an example. It's important for you to discuss with your renal dietitian what your protein requirements are specifically for you, especially if you're over or underweight, because the formula I'm going to show you is really for somebody who's already at a pretty healthy weight and isn't actively ill in terms of having an acute illness. So how much each day? The amount is 1.2 to 1.3 grams of protein per kilo for hemodialysis, or 1.5 grams of protein of kilo for peritoneal dialysis. A 75 kilo person, which would be like a 165 pound person, would therefore need about 90 grams of protein a day. That translates into about 8 ounces of meat, fish, poultry, or eggs per day. The way I always do this, if I look at the 90 up here, the 90 grams, I kind of get rid of the 0, and then I subtract 1. 9 minus 1 is 8. And so that gets you to your about 8 ounces of meat, fish, poultry, or eggs per day. Now, if you think about how much protein is in each, or how much protein is in each gram, that's not going to add up to be 90 specifically. So 8 ounces times 7, 8 times 7 isn't 90. But because we know you're going to get additional protein in other places, such as from your breads or rice or noodles, from your vegetables. But this can serve as your base, trying to figure out how much meat and that sort of items you're going to have for the day. In general, most people need between 6 to 10 ounces of high protein foods each day when they're on dialysis. So maybe you're thinking, gosh, 8 ounces is half a pound. That sounds like an awful lot of food. And so I want to break this down for you to show how it's really quite reasonable. 21 grams of protein would be about a 3-ounce portion of meat. So think about a deck of cards, or perhaps the size of the palm of your hand, unless you have really big hands. So this works for meat, poultry, seafood, or fish quite well. So you will always have your hand with you. So if you're at a restaurant and you're trying to figure this out, just sort of take a look. And if you've ordered that 16-ounce steak, you probably need to cut that at least in half, if not a third, and save some for another meal. 14 grams of protein is equivalent to about 2 eggs. And 7 grams of protein would be approximately equal to 1 ounce of cheese. And we typically would want to use a lower fat cheese or a lower sodium cheese if possible. And then finally, 4 grams of protein would be contained in about a half cup of milk or yogurt. Now, because milk and yogurt has a lot of potassium and phosphorus, typically people can safely eat about a half of a cup a day without any difficulty. So 21 grams plus 14 grams plus 7 grams plus 4 grams, all of this starts adding up pretty quickly. But how can we make this work for you? Let's think about the scenario where maybe you're getting dialysis on the first shift of the day, and dialysis gets in the way of breakfast. That happens a lot. One thing you could do if you're aiming for 8 ounces for the day is to have 4 ounces of meat, fish, or poultry at both lunch and dinner. So 4 plus 4 equals 8. And don't worry so much about the breakfast, and maybe just eat something light on the way out the door or on your way home. Or maybe you'd rather have a big breakfast and skip lunch. That's perfectly fine. Have 2 eggs for breakfast and maybe a mid-size homemade turkey sausage patty that's also about 2 ounces, and then have 4 ounces of fish, poultry, or meat for dinner. So 2 in the eggs, 2 in the sausage, and then 4 for your dinner. You're back up to 8. What if you're one of those people who just kind of likes to snack and graze all day? You could break this down in infinite ways. So maybe you have 1 egg for breakfast. Maybe you're in a hurry and it's just a hard-boiled egg. Or perhaps you have 1 slice of low-sodium cheese for a morning snack. What about having 2 ounces of low-sodium deli turkey for lunch? Maybe you just literally grab it out of the bag and go, or roll it up and have it with some low-sodium crackers, or make a little sandwich out of that. Maybe an afternoon snack could be a deviled egg, and then have a nice portion of trout or some sort of fish for dinner. You can graze and just eat small amounts throughout the day and hit your goal just as well. Basically, it's important that you divide it up in a way that fits your life and appetite best. So again, I can't stress enough the importance of discussing how much you actually need every day as your target goal with your renal dietitian, so you know how to best distribute not only the protein, but then all of those phosphate binders that you typically need to take along with those foods. The other thing I want to talk about protein is the importance of choosing carefully. This slide shows some chicken breasts that I picked up at my local supermarket, and as you can see here, it says Nature's Basket. So that implies that it's probably going to be fairly, quote, healthy. But when you're looking at chicken in particular, you have to be extra smart about it. It's a little bit hard for me to see here, so I apologize if this is hard for you to read, but this says this was hatched and raised and harvested in the United States. Well, that's all fine and well, but that still doesn't tell us if it's a good choice for us. But see here how it says minimally processed? Oftentimes, that's a clue that this food is going to be fine for you and isn't going to be laden with high sodium, high phosphate additives that are a problem. If we keep going on, it says no antibiotics ever, no added growth hormone, no artificial ingredients in an all-vegetarian diet. Again, that's fine and dandy, but at the end of the day, the only thing that's really useful here is the fact that it says minimally processed and that there's no little label here that says maybe 15% solution added. Another trick you can do to determine if your chicken, meaning unbreaded, unprocessed chicken or turkey or other meats are appropriate, is if there's a nutrition facts label on the back, take a look and look how much sodium there is. If it's less than 100 milligrams for a serving, and in this case it's a 4-ounce serving, then it's probably going to be just fine. Usually when phosphate additives or those sodium phosphates are added to the chicken, the sodium level starts going sky high. So a rule of thumb is as long as it stays below 100 milligrams per serving on the label, you're good. But it's important that I point out that not always will you find a nutrition facts label on chicken that's been processed, say in a supermarket and sold for retail. All right, let me page down. Oops, too fast. Okay, so that's what I want to talk about protein today. You can get it in, I know you can. The next topic I want to talk about at length is really what's the difference between phosphorus and potassium, and how can I safely manage these? I always found these P words to be confusing. And if I tell you a little secret, when I was first starting out to be a dietitian, I had to interview for my internship. And wouldn't you know, the interviewers were asking me questions about kidney disease and liver, and I got them all mixed up, and I got the P words, phosphorus and potassium, completely backwards. It's kind of funny I ended up a renal dietitian, but at least I've got them straight now. So what I tried to do for you is throw a little bone up here, because phosphorus mostly affects the bone, although it does also affect cardiovasculature. And potassium really affects the heart. So I'm going to try to use these throughout to explain this. Phosphorus is naturally found in many foods. And some of these foods are higher in phosphorus than others. And it's important to be aware of that and to limit those foods. But on the other hand, you don't have to completely avoid them. By contrast, phosphorus is often added as an ingredient in many processed foods, and in that case, it's very important to try to avoid these. When you're on dialysis, no matter whether it's peritoneal dialysis or hemodialysis, the guidelines recommend about 800 milligrams of phosphorus per day as the limit. Now, if you're on daily home hemodialysis, chances are you can eat phosphorus much more liberally because you're having much more dialysis and that's coming out quicker or more steadily. But for the vast majority of individuals who are still getting in-center dialysis or peritoneal, 800 milligrams per day is the limit. Potassium, on the other hand, affects the electrical conductivity in the heart. So this has to do with complicated pathways of ion exchange. And so just think about potassium in the heart. The problem with that is when this goes too high, you don't really get good symptoms. When your phosphorus goes too high, sometimes you have symptoms like itchiness, but not always. So both of these can be rather silent. You know, if they were both felt like they were stabbing you in the gut, you'd stop eating them because it would hurt. But that's not how these really work. And so you have to just be very smart and know how to manage this on a day-to-day basis. Potassium is contained naturally in many foods. And again, we want to limit these, especially those that are very high in potassium. But they're also sometimes added as an ingredient in processed foods. And the reason they're added is because they can be put in as a substitute for a salty flavor. So when you're trying to produce low sodium foods, you may put in extra potassium for the flavor enhancement. And that's fine for the vast majority of people who don't have kidney disease, and even many who have some pretty basic early kidney disease. But when you're on hemodialysis in particular, you really do need to limit your potassium level to about 2,000 milligrams a day, and your staff at the dialysis center carefully watch those values to make sure that they stay in a normal range. Because if they go too high, you may not get any symptoms, and there is the potential that your heart could stop beating, so it's very important. And I'm not trying to scare anybody, and I imagine you've heard this before. But the reality is we want you to be empowered to make these good decisions for yourself and know how to navigate this. Okay, let me try to get this. There we go. I'm going to overshoot again. Sorry about that. All right, now back to phosphorus. Like I said, phosphorus is naturally in many foods, and it's particularly present in animal foods. Eggs, dairy, meat, poultry, and fish. And it's also naturally present in whole grains. The interesting part about the natural phosphorus is that it's really bound up fairly tightly and you don't absorb it all. So what happens is you eat this food and some of the phosphorus gets freed and you absorb it and it makes your blood levels go up. Other amounts of it just sort of pass along in your gut and really never get extracted from the food. That's why you don't have to completely avoid phosphorus in the foods where it's naturally present. And to be honest, we just talked about protein. You need to eat a lot of protein, right? So we can't completely avoid eggs, dairy, meat, poultry, or fish. Well, unless you're vegetarian, and then you're going to be very strategic about how you're getting your protein. And that's beyond the scope of our topic today. Phosphorus that's added to foods, particularly poultry, seafood, frozen foods, baked goods, drinks, sauces, that's where we find it the most, that phosphorus is absorbed by your body 100%. It is so easy for those our bodies to suck the phosphorus right out of that food, and then it raises our blood levels significantly, and over time that's really problematic because it can reduce the calcium content in your bones, and it can contribute, it appears, to cardiovascular or heart and blood vessel problems, such that it causes a higher increase in death from heart disease in patients with kidney disease in particular. In terms of potassium, potassium is also naturally present in the meat, chicken, fish, dried beans, potatoes, but also some fruits and vegetables and dairy products. And I'm sorry, I noticed here that I didn't highlight that in the same way, and I didn't put them in the same order. But really, eggs are a little less of an issue of potassium as compared to what they are for phosphorus, but it's a lot of these same foods. Other high potassium foods include potatoes, and you are probably going to be taught how to soak your potatoes so that you can make like roasted potatoes or mashed potatoes or boiled potatoes in a way that's very safe for you to eat. Potassium is often added as an ingredient in those low sodium foods. Where I want you to look for it carefully are your soups, your broths, and some juices. So you're going to find that soon potassium is going to show up on the nutrition facts label. And that's going to be required starting July 2018. And for the general population, there's a push to increase potassium intake because it helps to control blood pressure. Now, that same thing doesn't happen in the same way when you have kidney disease and your kidneys can't excrete any excess potassium efficiently. But what it means is I suspect we may see more potassium added to foods. So for right now, you can start looking at the nutrition facts panel where it has the calories and protein and fat and sodium, and you're going to start seeing how much potassium's in the food. But until July 2018, it doesn't have to show up yet. So what we'll see is the manufacturer's transition here in the next 2 years. So it's important to know what foods to carefully avoid. So when I talked in that previous slide, if I pop back up here again, your soups, your broths, make sure you're reading the labels if they're low sodium to make sure in the ingredient list you don't see the word potassium where potassium is being added. If I go back to phosphorus, however, the bone problem, I want you to read your processed food labels, the ingredient label, to find PHOS or PHOS. The problem with these phosphate additives are these big, long chemical words. Trisodium phosphate is an example. Big, long, ugly words. But the nice thing is PHOS can stand out, and you can train your eyes to actually hone in on those letters fairly quickly. So when you're looking at a processed food, whether it's a soft drink, particularly colas, you know it's going to be in there. Almost all of the colas. If you're looking at a frozen food, if you're looking at a baked good, if you're looking at a packaged chicken dish, chicken tenders, chicken nuggets, pulled pork, and anything like that, I want you to take a look not at the nutrition facts label at the top where it says how many milligrams of sodium and how many calories and grams of protein, but instead at the ingredient list to look for that PHOS. The federal government is not going to require phosphorus to be listed on the nutrition facts label at this time. And I can tell you renal dietitians and organizations nationally petitioned and advocated that this get added to the food label, but the deciders decided that they were going to add potassium, but they're not adding phosphorus at this time. Let's talk about lower potassium vegetables. This talk is about what you can eat, and so I'm really focusing on those foods that are okay and safe for you to eat. We really want you to enjoy your vegetables. And what you're going to find is that lower potassium vegetables are abundant. I think it's very easy to focus on what you cannot eat whenever you're given a special diet like this. And really, you want to focus on what you can. So I want to go through this list. Lettuce, celery, cucumber, carrots, bell peppers, radishes, zucchini. Imagine the salad you can make with those. And these can be cooked, like cooked carrots, or maybe cooked celery in some soup, or some sauteed zucchini or grilled zucchini. Other low potassium vegetables like onions and garlic can provide so much flavor. Low potassium vegetables like green beans, asparagus, snow pea pods, yellow squash, those all are terrific, whether they're sauteed, roasted. You can make a stir fry out of these. You can steam these. They're all very, very fresh and terrific. Raw spinach is low in potassium. But if you've ever cooked spinach, you know, you can take a great big package of spinach, and if you heat it up, it turns into just a little pile of spinach. And so that potassium is riding right along. So cooked spinach ends up being a fairly high potassium vegetable, whereas the raw spinach is quite low. Cauliflower is another good lower potassium vegetable. Corn is lower, but really we want to stick to a reasonable portion here. Cabbage is another good choice, mushrooms and eggplant. So again, I want you to use your imagination and think about how can you incorporate these vegetables into your diet on a daily basis. They don't have a lot of calories, so if you're underweight, they're not going to help you gain weight so much, but they can all be carriers for oils. So again, you cook them in a method that incorporates some fat or add some butter on top of them, and that will add the calories for you. We really suggest aiming for about 3 to 4 servings of the lower potassium vegetables a day, and a serving size is 1/2 cup cooked or 1 cup raw. And again, as I was talking, enjoy these in a variety of ways. Some other ideas that I thought of when preparing this are things that I just do on a regular basis in my own home. You can toss these vegetables with a homemade Italian dressing and then put them on the grill. Again, I love that for zucchini in particular. You can toss these with some oil and herbs, spread them out on a cookie sheet, and throw them in your oven and roast them. I always suggest putting them on some foil or some parchment paper because otherwise the pan's quite a mess to clean up. You can stir fry these with a little sesame oil, ginger, a little bit of broth, particularly low sodium broth or homemade broth, or a little bit of wine, and maybe a pinch of sugar or some lemon juice. And that makes a very nice flavored stir fry. If you want to make a little extra of the broth or sauce to go with it, you can add a little bit of cornstarch with a little bit of cold water, stir that up and mix it in, and that'll thicken it up for you. One of the other things that tastes so good is to just squeeze some fresh lemon or lime juice on top of your vegetables, especially in the summertime, this time of year. It just really kind of brightens the flavor up significantly. Now let's talk about fruits. Again, I live in Ohio, and I really wait for June to roll around. And this week, for the first time walking into my supermarket, I'm finally seeing things that I love, like cherries. It's important to aim for 2 to 3 servings a day of the fruits and enjoy these in a variety of ways. And as I'm looking here, I'm like, where is my low potassium fruit slide? Ah, here it is. Okay, some of the lower potassium fruits would include apples and pears, strawberries. They're very much in season here right now. Blueberries, cranberries, mandarin oranges. These are great because typically we're told don't eat oranges. But if you have a tiny little halo or cutie orange, you're going to be just fine. Or a little cup of the processed fruit cup mandarin oranges. Now please don't eat 6 or 10 of these because then it collectively accumulates to be too much. But to enjoy a serving of this on any given day is perfectly safe for most people. Grapes are another lower potassium fruit that are fine. But again, stick with a handful. Please don't eat the whole bag at one sitting. Fruits like pineapple, cherries, plums, blackberries, raspberries. We talked about the tangerine or halos already. Watermelon. I often got asked, can I eat watermelon? And the reality is it's okay in potassium. It's a lot of fluid. So be careful with your portion sizes and count this as part of your fluid for the day. What about fruit cocktail, applesauce, or a small peach or nectarine? I think it's a wise idea to have a combination of canned or frozen fruits to have on hand, as well as fresh. So when you run out of the fresh, you're in good shape and you still have your fruit available for the rest of the week or the rest of the month, however you do your grocery shopping. But again, when this food is in season is when you want to be buying it because it's most affordable and it's really at its peak. If it's grown locally, the vitamins are going to be that much more in the fruit or vegetables even when it gets to you, if it's just been picked that morning or that week, as opposed to something that's flying in, like in my case, flying in from California. Doesn't mean I'm ungrateful that a lot of this is coming out of other states because it allows us to eat this stuff year-round, but it does make a difference in terms of taste as well as nutrient composition. So backing up for my slide here, again, eat these in a variety of ways, and if you need to add calories, feel free to dip your fruit into some cream cheese that's been blended with some fresh fruit. Maybe you need to thin it down with just a tad of juice. Make them into a fruit crisp. I love apple crisp, blackberry crisp, blueberry crisp, pear crisp. You can do this in a multitude of ways. But again, one portion at a time. Don't eat the whole pan. You can dip these into whipped cream or make them into a small smoothie. And I mean a small smoothie. And you can really process down a lot of fruit real fast and really overdo it and end up with a collection of low potassium fruits into a serving of a high potassium because you've used too much. But this can be an opportunity that you can add a scoop of whey protein and get some extra protein if you're struggling with meeting your protein needs. What about fluid balance? This is really best managed in a two-prong approach, dealing with sodium and dealing with the liquids or the fluids. They really heavily influence one another. For most people, sodium is going to be limited to 1,500 to 2,000 milligrams a day. One restaurant meal very easily can exceed this. And so what you're going to find in this next couple of slides is me advocating for some home cooking and really use of basic ingredients so that you can still have very, very flavorful food without blowing your sodium in one meal and then going into dialysis and experiencing a lot of cramping because you just gained too much between treatments. That's always been hard for me to watch. So sodium is limited to 1,500 to 2,000 milligrams a day, and salt or table salt is made up of sodium. So one measuring teaspoon of salt has about 2,300 milligrams of sodium. So you can read your food labels and find sodium because it's required by law to be on most of your packaged foods. Now, as I stated earlier, it's very, very important that you use caution with your low sodium food items. Make sure they're not enhanced with potassium for flavor. So again, look at the potassium content if it's on the nutrition facts label, and also take a look at the ingredient list. Sodium is often found in foods that don't taste salty. For instance, bread. A slice of bread, unless it's homemade, but even some homemade, has a fair amount of sodium in it. And so does unseasoned meat and milk and all of these natural foods, because just like in your body, sodium is very important for fluid balance and electrolyte transfer throughout the body. Same thing for animals. So any animal food is typically going to contain some sodium. Now, that doesn't mean that a chicken breast that's not enhanced, sort of like that label we looked at earlier, that's not the same as a hot dog by any means. And again, if you're logical, I know you know it. But how can we make foods taste good without salt? And what if you're getting sick of Mrs. Dash? My recommendation is really very generous use of fresh and dried herbs. And if you've got a sunny corner, whether it's in a window, in your deck, on your patio, by your front door, take the opportunity to grow some fresh herbs. If you get too many, you can always cut them off, clip them together, hang them up somewhere in your house, or stick them in a paper bag and let them dry out. And then you've got some dried spices very, very affordably. I recommend using spices like basil and oregano, garlic, chives, sage, cilantro, mint, parsley, and again, squeezes of lemon or lime. Or if you like spicy food, here's your opportunity. But instead of using a whole bunch of just hot sauce out of the bottle, how about using some of the peppers cut up, whether it's jalapeno or ancho or any of those. All of that adds a lot of flavor. There's other ways to do it too, like flavored vinegars. Those can work quite well. Now, what about fluid? Fluid accumulates in your body between treatments, right? So you were probably given a fluid restriction. And quite often, that restriction is only 4 cups a day if you're not making urine anymore. And that has to be really tough, especially on these hot, sunny days. So I want to point out here that if you're on peritoneal or have daily home dialysis, you probably have much more unlimited fluid restrictions and maybe even sodium. And these recommendations are really targeting those on in-center hemodialysis in terms of quantity. Now you have to remember that liquids include anything that's liquid at room temperature, whether it's ice, soups, pudding, beverages, or smoothies. Trying to advance this slide here. There we go. So when you're trying to select fluids, I want you to think about looking on the label for PHOS, because surprisingly it shows up in the darndest places like vitamin water or bottled iced teas. It's not just in your Coke and Pepsi that we've advised you to avoid. So please take a look at your labels in that regard. Some of the flavored waters have quite a bit of phosphorus added to them. If you're overweight, we will always encourage mostly water or zero-calorie drinks to make sure that you're not exceeding your calorie level. But if you're underweight, here's a smart opportunity to add some calories. So some safe fluids to drink to control potassium and then also phosphorus would be your low potassium fruit juices like grape juice and cranapple juice. But again, don't drink multiple cups a day because those low potassium servings will add up to a big potassium dose. What about lemonade or maybe some Kool-Aid or a clear soda or pop, as we call it here in Ohio, like Sierra Mist or Sprite or 7-Up? Sweet tea. You can make this yourself. Brew some tea, dump it over some ice, add a little bit more water if you need to. If you want to sweeten it up, stir in a little bit of sugar while it's still hot. Popsicles are also an opportunity to add calories. If you're trying to control your fluids and you're just running over, take a look at how much salt you're getting in your diet or how much sodium, but then also don't forget to use things like gum and some hard candies, lemon drops, or mints for thirst. Just make sure you brush your teeth really well with that sugar. There's lots of sugar-free options as well. So let's pull this all together. In the United States, we are now recommending what's called the healthy plate, and that comes from myplate.gov, which I'm showing here. And what I'm going to do is give you a variety of opportunities where we're using high protein, low potassium, lower phosphorus foods to demonstrate how you can make your meals look and still have lots and lots of good nutrients and meet all of the requirements in terms of providing carbohydrates, protein, and fat in a healthy way. So first of all, here in the corner is fruits. So I'm suggesting perhaps having some strawberries. along with a protein, which would be your grilled chicken thighs. And you could certainly cook those any way you like. Why don't you serve that with some rice and a buttered roll? In your case here, you can skip the dairy because we certainly don't want dairy at every meal, or your phosphorus and potassium could be too high. I'm going to assume you already had used a little milk at breakfast. And then round that out with some vegetables, like a salad with homemade Italian dressing and maybe some green beans. If that's just too many different foods to prepare, then strip it down. Do your grilled chicken thighs, have a generous portion of rice, have your strawberries, and just have your green beans. And those can be frozen green beans, those can be fresh green beans that you could cook. The frozen ones, though, are fast. You can do those in a minute in the microwave. Oops, I just realized I forgot to mention something. I put in the corner here, if you need to add some calories, you can put some butter on that roll. You can put some butter on your green beans, some on your rice, or I drizzle a little oil on those. You could fry that chicken or have fried chicken in the first place, and you could use some whipped cream on your berries. You can add a lot of calories to this, or you could really keep it pretty lean, depending on what your body size requires. What about this lunch? Let's start with some low-salt deli turkey, about 3 ounces, and let's wrap that up in a tortilla wrap. Throw in some shredded vegetables like cucumbers, bell peppers, or carrots. I buy carrots already shredded, saves me a step. You could also have some additional vegetables to munch on if you're still hungry, like some raw baby carrots and celery dipped in some ranch dressing. And then maybe you didn't have your milk for breakfast, and here for dessert you want to have some Greek yogurt and slice in some grapes. Again, you can imagine any fruit here, any vegetable here, any protein here, any grain here to turn this into a lunch. And I like to break it down this way to make sure you're getting lots of micronutrients in addition to the macronutrients like protein. What about if you're entertaining? There's no reason why everybody can't eat what you're eating. Let's start with a 3-ounce steak. Maybe you're going to splurge and not have as much protein earlier in the day, and you're going to have a little more for dinner. So maybe that turns into a 4 or 5 ounce portion for you. What if you serve that with some pasta salad? And in that pasta salad, you chunked up some cucumbers, some zucchini, threw in some shredded carrots, and a few quartered grape tomatoes. Yes, you can have a tiny bit of fresh tomato. It's not going to hurt a thing as long as it's fresh and it's just a little bit. Maybe you want to round that out with a half an ear of sweet corn, only a half or you're going to end up with too much potassium, and some coleslaw, particularly if it's made with a vinaigrette dressing, and you serve a really pretty fruit salad for dessert, like blueberries, strawberries, grapes, and apple slices all chunked up and mixed together. I'm getting hungry. I haven't had lunch yet. And then breakfast. What if you started with an omelet, 2-egg omelet with an ounce of cheddar cheese? Right there is your 3 ounces of, quote, meat for the meal. Throw into that omelet some sauteed vegetables like some mushrooms, peppers, and onions. Serve it with 2 slices of buttered toast. Have your half cup of milk, and maybe have a small bowl of fresh cherries because they're in season and taste so good. Again, you can imagine so many different ways to do this, but at the end of the day, I'm encouraging you strongly not to think about what you can't have, but more about what you can have, and play up those foods instead of focusing on the negative. The last thing I want to point out is I often get complaints that this just costs way too much, and I know that that can be true in some cases. So I wanted to throw out some really a more affordable menu. Again, you can slice and dice this in many different ways. What about 2 or 3 chicken drumsticks? And please don't just buy the wings. The wings often cost more than drumsticks or thighs, and they have far less meat, therefore far less protein. That skin just is not the source of protein. So go for the drumsticks or the thighs, or maybe the tenderloins if you're trying to save money. And then also try, if chicken breast is on sale and you've got a little room in your freezer, stock up. But again, take a look at your chicken and poultry and make sure it's not enhanced with that broth, or that it's less than 100 milligrams per serving when you look at the nutrition facts on the back of the panel. Cup of buttered noodles. not expensive. Vegetables, canned green beans rinsed. Yes, they're going to be higher in sodium than maybe fresh green beans, but they're not going to rot in your refrigerator, so they're there and they're affordable. And then finally, maybe finish that up with a small portion of mandarin oranges and your half cup of milk. So again, on a tight budget, you can make this work. The protein is often the most expensive part, so that's where you want to try to pay attention to grocery store sales and stock up where you can. Meals don't have to be hard. Plan ahead. Use your store flyers to find sale items. Balance fresh with frozen produce and make sure you use it up. Don't buy a whole bunch and let it rot in your fridge. It's okay to use sandwiches, wraps, or main dish salads. Just start with that healthy plate like I showed you and incorporate your protein, grain, vegetable, and fruit. Leverage your village if you don't have the energy to cook. Is there somebody at church? Do you have friends, extended families to help? Stock your freezer with prepared meals created with your input. Use your freezer. It's just as fast to make 2 meatloaves or 2 pans of meatballs and freeze one. Rice and pasta freezes fine. For pasta, just dip it in boiling water quickly and it reheats rapidly. Try to keep some turkey or beef burger patties, just the plain ones, in the freezer ready to go. And make homemade turkey sausage by taking ground turkey, spice it up with some black pepper and sage, and make some little hockey pucks out of it in your oven. It doesn't have to be dry and icky, but seriously, this is a very affordable way to make good tasting sausage for yourself. Try to plan your meal around that main dish, meat, chicken, and fish, so you meet your protein needs, and maybe pick a theme of the day, like Italian one day, Mexican one day, chicken one day, beef. You can see from my slide, I give you some ideas. So to summarize, as we wrap up the last few minutes here, it's really important to make sure you're nailing your protein needs. So think about how much is required and how can you meet this requirement. Understand thoroughly the difference between potassium and phosphorus and make sure you can safely manage these. And then manage your fluid balance through careful sodium or salt and fluid use. And then finally, use that healthy plate to pull this all together. It just doesn't have to be hard. I'd like to take this opportunity to thank the American Kidney Fund for inviting me to do this presentation today. And I'm from Cleveland. I have to say, go Cavs. Thank you.
Thank you so much, Janine, for joining us and leading such an excellent and informative webinar. At this time, I'm going to ask Janine to answer a few questions that we've received over the course of the webinar. So the first question is, how do you estimate the amount of fluids inside of fruit, like if you wanted to eat watermelon?
So for watermelon, I would just assume a cup of watermelon is a cup of fluid because that's just easier. But other fruits, if it's a real juicy peach or a real juicy orange, I would probably still only count that as maybe 2 to 4 tablespoons, which is about an eighth to a fourth of a cup of fluid. If you've ever squeezed the juice out of a lemon, you know you only get 2 to 3 tablespoons. So I assume you're going to do about the same out of your other fruits.
Thank you. So the next question is, what should I do if I forget to take my phosphate binders when I go out to eat?
You plan ahead for next time. So it's probably useful to still go ahead and take your binders when you get home, if you're going to get home quickly, because we know that the stomach empties at a certain rate. But the bottom line is you want to prevent that. So set yourself up for success. Make sure you have some in your purse. Make sure you have some in the car glove box. So make sure you're planning ahead as much as possible. And the reason that's super important is most of the chicken and the meats that you're going to get at a restaurant are going to be enhanced with those phosphate additives. If anything, you probably should talk to your dietitian about, or your doctor if you eat out a lot, about possibly taking extra when you do go out to eat.
Great advice. Thank you.
The next question, is it okay to use canned vegetables and fruit?
Absolutely. Obviously, fresh and frozen are going to be typically lower in sodium, or in the fruit, maybe lower in sugar. But if you buy your fruit packed in water, and in both cases, please drain these and rinse them off if you can. I may not rinse the fruit, but drain them, rinse them, and cook them in fresh water if you're going to be heating up the vegetables.
Okay, thank you. And the last question. In the hot weather, I really get thirsty. How can I limit my fluid but still stay hydrated?
So this is something that if you are really out in the elements a lot, you really need to tailor that with your dietitian and physician as much possible. Because if you have more sweat, you're therefore losing more fluid. So you might actually need a little more fluid than just 4 cups a day, or whatever that target amount is on it for a day that's cooler or you're more sedentary inside. But the way I suggest managing it is to really ration it. You can always put water, ice cold water in your mouth, swish and spit. That works well. Chewing some gum, keeping some of those candies. They've got, actually, it's like almost like a candy sour product on the market that you can use that'll help to pull saliva into your mouth so you don't feel so dry of the mouth. And then also just be careful with how much sodium you're eating, so that when you're eating saltier foods, that tends to make you more thirsty.
Okay, well, thank you so much, Janine. It's been great having you present today. Our next webinar will be held on Tuesday, July 19th from 1 to 2 p.m. Eastern Time, and will be about staying employed with kidney disease. It will be led by Mary Beth Callahan, a senior social worker at the Dallas Transport Institute. Mary Beth works with chronic disease kidney patients as well as pre- and post-transplant recipients, and was the 2015 NKF Council of Nephrology Social Workers Robert W. Wilcox Lifetime Achievement Award recipient. That was a lot to say. Registration is now open. Please visit kidneyfund.org/webinars for more information and to register. When the webinar closes, please do not close your browser window. You may see a pop-up saying that the webinar has ended. Please close that pop-up and proceed to the webinar evaluation survey. Your honest feedback will help us make our webinar programs the best that they can be. And from everyone here at the American Kidney Fund, thank you so much for joining us today. Bye.